Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Bryan Cheever of Hamilton Family Medicine Clinic. Dr. Cheever is a board-certified family medicine physician at Hamilton Family Medicine Clinic, a new practice inside of Hamilton Physician Group, Murray Campus, at 800 GI Maddox Parkway in Chatsworth. Dr. Cheever is also the program director of Hamilton's Family Medicine Residency Program. Dr. Cheever completed his medical training at the University of Tennessee College of Medicine and his internship and residency at Florida Hospital. He treats adults and children aged 2 and up. Dr. Cheever, today we're going to be talking about smoking as well as Hamilton Family Medicine Clinic. Tell me, is there a way to be screened for lung cancer?
Yes, there is. So now there's a new technique, the low-density CT scan, which is approved for lung cancer screening. Not only is smoking affect you, but it affects those around you. So what we call secondary smoke is other people inhaling the smoke around you. And we know that's a risk. There are like 2,000 or 3,000 people a year that die of lung cancer who did not smoke.
Oh.
Many of those are secondhand smoke exposure. There are other things too. And then also we now talk about tertiary effects, which has to do with like parents with the smoke on their clothes and the effect it has on the respiratory and the health of their children.
Just because you have smoke on your clothes?
Even if you smoked outside or didn't smoke in the house, but you have it on your clothes, then and in your hair, then it also has some effect.
Yeah, and the cost of smoking is tremendous.
Yeah, so cost is the other thing. So pay now, pay later. The thing is because I looked it up, and the average pack of cigarettes is $6 to $10 a pack.
For one pack?
For pack.
I had no idea.
In Georgia, it's right about $6.
Okay.
But at $6 to $10 a pack, that's $4,000 a year if someone smoked a pack a day.
And you just burn that money, literally.
Literally up in smoke.
Up, yes, literally up in smoke.
And if someone smokes 2 packs a day, that can be as $8,000 a year. That's a car payment. That's a vacation.
Oh,
nice vacation.
So sad. So sad. Now, what about people who are smoking? How can people quit? What is the best way to quit smoking?
So obviously the best way to quit smoking is don't start. Other ways that people use to quit is cold turkey. That for some people, mind over matter and cold turkey. There are medications, nicotine patches, nicotine gum. Those are all medications that can be helped. Some of those are actually over the counter. Counseling. So there is direct counseling that can help. Biofeedback. And then part of counseling and even assistance is the Georgia hotline. So Georgia has a hotline that people can call to help quit. And that number is 877-270-STOP. And then they even have a Spanish line, which is 877-266-3863, which really is 877-2-NO FUME, which means no smoke.
Those are some very good things that people could use to help them stop smoking. And that support that you can get, you talked about support, that's very important.
Right. The Georgia Hotline offers counseling, other services, and sometimes even assistance with the medications to help quit.
Well, now I've heard that it is so addictive.
Yes.
What are some of the barriers to quitting smoking?
So, of course, some of the barriers, one is, of course, the physical dependence, absolutely dependent on the nicotine. And so that's how some of the medicines work. But it is a physical dependence. Some things, it's also a habit. So it's not only the habit of the smoking and the dependence on the nicotine, but it's also hand to mouth. So, you have to get rid of that. And then it's anytime you're going to quit, you have to replace one habit with another habit. So you realize that it's a habit, and so you got to replace it with a good habit. There's some thought that the brain, if you take away a habit, then there's an empty spot and it will fill it with something else.
So fill it with a good habit.
Fill it with a good habit. So plan ahead and cut up vegetables or like carrot sticks, celery sticks, or something that you can plan ahead. Otherwise, when you get that need for hand to mouth, you'll just grab whatever's there, which is potato chips, candy bars, junk.
Yeah. But better than smoking.
Right.
Something better than smoking.
The other barrier to quitting is a lot of times people, good intentions, want to help somebody, but there's a difference between nurturing versus nagging.
Yes.
Between controlling and supporting. And so a lot of people, when I'm talking to families, I'm trying to help them to understand how they can support the person to quit and not be part of the problem by nagging them and controlling them.
I got you. And the Georgia hotline, that is still there to help, correct?
Correct. And the Georgia hotline is a very good because it is a service that is a support service for someone who wants to quit. And that's not just smoking, that's for vaping and chewing tobacco and other tobaccos.
I got you. I understand. So not just smoking, but other tobacco products that cause cancer.
Yes, correct.
Yeah, got you. And now, are there any classes or maybe programs available to help people stop smoking?
Yeah, there's several good programs, and even now the People's Cancer Institute at Hamilton Medical Center has a program that is the American Lung Association 8-week quit smoking program. Thousands of people become smoke-free through the Freedom from Smoking group clinics, which offer more of a structured and systematic approach to quitting, which helps people. It's got a facilitator. It really looks at how do we really need to quit, medications that can help your success, lifestyle changes we can make by substituting a bad habit with a good habit, things like that, how to prepare for your day to quit, and then strategies to help managing stress, weight gain, things like that, because those are the things that is a lot of people suffer from. One of the reasons they smoke is for stress management or weight or for just comfort, but finding ways to substitute that and manage stress and weight in healthier ways.
Yeah, don't grab those potato chips or those candy bars you mentioned a minute ago.
Correct.
Yeah, to fill that void that you have.
Right, because if you don't plan ahead, you're going to fall into the trap again.
Oh, you don't want that.
Yep.
After all that work.
Yep. And for Hamilton, you can actually go online to hamiltonhealth.com/quit, or you can call 706-226-8966 for getting set up for one of the smoke-free programs. And then also Hamilton offers the low-density CT scan. I've referred people for many years to that. In fact, the first patient I referred for that screening actually had lung cancer and is doing well even today, and that's been since they first started doing those screenings.
Great.
And what this CT scan identifies is even this patient that I first sent, no symptoms, had no cough that was unusual, no weight loss, nothing that would identify. That's why lung cancer is so bad. People present a lot of times when they are already too advanced. And in this case, we were able to identify it very early and get treatment.
Which is so important.
Correct.
The earlier, the better.
Correct.
You know, we've been talking about smoking and cancer. I want to talk some about your practice. How is Hamilton Family Medicine Clinic different from other physician practices?
So our Hamilton Family Medicine Clinic is sort of a new practice. We are resident physicians, provide comprehensive medical care along with board-certified family physicians. And whether you need medical care for common illnesses, complex or chronic diseases, our team is there to take time to listen and provide the care that is needed for all those treatments.
Well, that's very good. That is excellent. Now, when you talk about residents, are they doctors?
Yes, they are graduated from medical school. They have their MD or DO degree as physicians. Now they're training in a specific type of practice, in this case as family physicians.
So Hamilton is also a teaching hospital?
Yes. Hamilton Medical Center healthcare system is now an academic institution. We teach residencies. We also instruct medical students.
So what services are provided at Hamilton Family Medicine Clinic?
So we treat patients typically 2 years old and up. Services that we do, annual physical exams, diabetes care, geriatric care, high blood pressure, high cholesterol management, depression, anxiety, mood disorders, arthritis and chronic pain, respiratory illnesses and infections, including COPD and asthma, minor surgical procedures, particularly like in dermatology and skin stuff. And we do on-site lab testing as well now.
Oh, that's good. Even an on-site lab.
Correct. And x-ray.
Dr. Cheever, thank you so much for sharing all of this great information. If you would leave our listeners with one word of advice, what would that be?
So don't smoke. If you do, call the hotline, see your doctor, get the assistance needed to quit. And if you qualify in the age group of 50 to 80 for the LDCT, then see your doctor about getting that scheduled. That's an annual test.
Great. Dr. Cheever, thank you so much. For more information about Hamilton Family Medicine Clinic, call 706-686-8015 or visit hamiltonhealth.com/family. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.